So a separation is typically occurs when someone falls on the tip of their shoulder and you injure the ligaments, and ligaments by definition connect bone to bone, so you injure the ligaments that connect the collarbone to the shoulder blade bone. An AC separation is diagnosed, one, by the history, by the mechanism of the fall, and a lot of times we can figure it out from that, but also by physical exam. If a patient has swelling and pain to palpation directly over the AC joint, that usually represents an AC injury. Sometimes an X-ray can be helpful because an X-ray can tell me if the clavicle is displaced or not. So an X-ray tells me if it's a type 3 or above. And that is important because if you have that higher classification, then that can affect the treatment.
So falls generally can cause a rotator cuff tear. We see it in the winter with fall skiing. We see it in the summer with falls off bicycles. And as you fall and brace yourself, if there's a high load on the tendon, it can tear.
In this area, the most common fracture I see are clavicle fractures, or the collarbone. And that happens from all the falling people we have, whether it's from mountains, tabletops, roofs, bicycles. And the second most common upper extremity shoulder fracture in the older population who break the ball or the humerus. And that fracture comes from being osteoporotic and not having the strongest of bone and falling on the outstretched hand or onto the shoulder itself.